So greetings everyone, my name is Jean-Pierre Kekens from Covexit.com, and I'm very pleased to welcome today for an interview Dr. Ira Bernstein from Canada. Welcome, Dr. Bernstein.
Good morning. Good morning, Jean-Pierre. It's a pleasure to be here with you and our audience to discuss all things COVID.
We are going to discuss two particular elements in this interview. One is the Rome meeting, including that declaration that was read at the end of the meeting, and then a more recent development that occurred actually yesterday, and that is Canadian, and it's the publication of a COVID-19 declaration by the Canadian COVID Care Alliance. So we are going to cover this in this interview. And maybe to start the interview, I would ask you to outline what was that Rome meeting. There were 3 days, isn't it?
That's correct. 3 days, 3 different locations, all about early COVID care. That was the focus, to bring international experts, those who have experience treating COVID as an outpatient, to reduce hospitalization, reduce death, to gather the experts together to share their experiences. Physicians from all corners of the world. Many physicians arrived in person. There were some, however, that had to provide their information by Zoom. But this was an opportunity, for doctors to get together in one place to bring the message to the international community, to discuss outpatient care, to dispel the common narrative that there are no treatments available. So that is the essence of what happened. Additionally, it allowed physicians to have this camaraderie. So many of us have never met before physically. We know many of each other by Zoom meetings, but to have the ability to physically be in one location in just a magnificent city. Rome is just, I think it was the perfect location, to get together and share our knowledge and share it with the world as it was live streamed. At least days 2 and 3 were live streamed. Day 1 was recorded and will be available at some point, for the different discussions that took place. So, just to give an idea of the format, on the first day, many different physicians from different countries gave presentations. They were approximately 20 minutes in duration, and they discussed different aspects of how they are doing it in their respective countries. So this was a full day session, and this took place in a downtown hotel. Day 2 is very interesting in that it took place in the Roman Senate, which is near the Pantheon in the heart of downtown Rome. So we had the opportunity to discuss in 15-minute presentations that took place most of the day. Got off to a little late start. It was supposed to start at 10, but the way things work in Italy, things don't quite work on schedule. So there was a bit of a delay, about an hour to get going. And I had the opportunity to do a little presentation on that day as well. I did a discussion on prevention with nutrition. So I talked about this is an area that I have a passion for. I've been very interested for the last at least 10 years talking about nutrition and supplementation and optimizing cellular health. This is something that is deep to my heart. Actually, going going back from when I had a health challenge and conventional medicine was not able to assist me. And this is what opened up my eyes to really a whole new world of complementary care with the use of nutrients. And so I have 10 years of experience taking courses back in Canada, nutrition for docs. This is information that is not taught in medical school. Uh, Medical students get no discussion, no education on the value of nutrition. It's quite unfortunate because it's so important. Medical school talks about diseases and disease management. There is very little focus on prevention and optimizing your cellular health, which is the root cause of many of the degenerative diseases that we encounter on a daily basis in our practice. So I learned from the experts 10 years ago, specifically Dr. Aileen Burford Mason, a brilliant immunologist in Canada who gave these courses. And I took all of them, and I've read all of her books. And I brought some of that knowledge with me to Rome. Information from some dating back 10 years. Much of it hasn't changed, and yet most physicians and the community have little understanding of the role of nutrition. And so it was very timely with respect to COVID-19, because we know that there are important nutrients for optimizing your cellular health, your immune health. We talk about, we've been talking for a year and a half about the importance of vitamin D. Now, in my own talk, I didn't focus on that since another physician did a full presentation exclusively on vitamin D. You can talk for hours on the evidence of vitamin D, which is so important for your immune health. But in countries like Canada, our health agencies seem to dismiss vitamin D. They talk about it as fake news. Our health minister several months ago, when questioned about the importance of vitamin D, she said, "I don't listen to fake news." So there is so much misunderstanding about the importance of nutrition, but we know with vitamin D specifically for years how important it is for the immune system. And we know for COVID-19 that persons who are deficient in vitamin D have a much higher likelihood of ending up in hospital, developing that inflammatory cytokine storm that can be oh so dangerous. And simple things like vitamin D are important in helping to prevent. It's not the only thing. I don't want listeners to get the message that just taking vitamin D is going to save you, but it's the whole picture. And so I talked about that picture of all the different nutrients and helping prevent degenerative diseases. So that was my presentation in the Senate, and many physicians on day two shared their experiences on many different subjects, and this is all available. This can all be viewed. Currently, it can be seen on YouTube on the International COVID Summit channel. The days are there currently in the raw formats. So it's several hours together, so it might not be easy to digest. But what they are doing, they are breaking down the talks into the individual segments, and they are also being translated into, I believe, 4 different languages, so that it will reach a larger audience. Many presentations were in Italian. I was not able to understand them. I don't speak Italian. So I'm going to have to review, come back and watch some of those presentations again, so that I'll have a further understanding. Some were in Spanish, and others were in English. So that was day 2 at the Roman Senate, and there were senators there. There was also a Croatian member of parliament who serves on the European Union Parliament. He's not an MD, but he has a significant interest in what we are doing and understands that early outpatient care is important. And he took that information, back to Croatia and did I viewed a short brief that he presented. I'm not sure who his audience was, whether it was the other members of parliament in Croatia or the European Union, to talk about this event and early treatment. So that was very interesting. And he was very interested in what I had to say, because during the break time he asked for a photo opportunity with me. So that meant the information that I had resonated with him, and I think it resonated with all of the people that were there. So after that, that was the Senate, which is a full day. On day 3, which took place in an outdoor theater near the Coliseum, and this was an opportunity for representatives from each country around the world who were present at the summit to give a 50-minute presentation, just to bring their message to the world, anything they wanted to talk about. And I was the exclusive physician from Canada on site, and so I did another 15-minute presentation there, basically talking about my experience as a treating physician when I got involved with COVID management as an outpatient, and talked about the situation in Canada with suppression of early care, the difficulties that we're experiencing, the media, Health Canada, with their recent statement on ivermectin in a very negative light. And so I sort of hit back at what I feel is some of this misinformation, ignoring the evidence from our authorities. This I think that it's very important, because we're here to trust. Canadians want to trust our authorities, our regulators. These are people that Canadians look up to for the truth, and it's problematic for many of us when there's this conflict, when these authorities are giving a message that is quite contrary to frontline physicians' experience and the plethora of evidence that's out there. And it's amazing how the media and the authorities continue to dismiss the ever-increasing level of evidence for the multiple therapeutics that are out there to use off-label for the treatment of COVID, and something that I've been doing since last November 2020, when I treated my first patient. And I would say I'm late in the game. Many other well-known physicians, like George Fareed, who I met there, which was exciting, because we've talked together many times on Clubhouse, and it was exciting having that opportunity to see him in person, and just see the humanity. These are physicians that there are no conflicts of interest here. These are all doctors who are trying to help humanity, to reduce morbidity and mortality, and bring this pandemic to an end. And this is something that is achievable. But there is these strong forces that, for whatever reason, are giving different messages that these things don't work. And of course, all of these agencies and media and so forth, academics who claim that these therapeutics don't work are not frontline physicians. They do not treat patients. You have to ask the people who are treating the patients what works, and that was that. It was also very exciting having Robert Malone, who moderated the day 3 session. And I have to say, having the opportunity to meet Dr. Malone for the first time in person on Sunday, which was day one, was really an incredible experience, because we've known each other through our first communications back in April, when Steve Kirsch had me on a conference call with Dr. Malone. I didn't know who he was at the time. Steve Kirsch had introduced him, to me as the inventor of the mRNA vaccine technology. And I thought, wow, this is someone, I think, very important. And he was interested in having this, this engagement with me and hearing what I had to say, as a practicing clinician. So, we've been on other calls, Zoom calls, in the ensuing months. But when we met together on that Sunday, I'll tell you, it was like meeting a long lost family member. We had this hug, and it really felt very special. Being together with these people that I would call not only my colleagues, but they are friends, they are champions, and we had many opportunities over lunches and dinners, and had all of these wonderful conversations during our 3 days together in Rome. So this was all about hope. This opportunity allowed doctors to bring hope and share with the world that there is hope for this pandemic. There are treatments, and different clinicians have different experiences with different medications. So we aren't all necessarily following the same protocols. There's multiple protocols. There's multiple treatments that are available. There's some treatments, for example, that the physicians from Poland talked about. And that was with the use of amantadine, which is another very old antiviral that's used in influenza outbreaks. It's been around, I think, for decades, much like hydroxychloroquine, much like ivermectin, out for decades, a safe and repurposed medication. So there are options, for treating, and I learned different things, additional therapies, gained some experience from Dr. Bruce Patterson, who is the international expert in long COVID and talking about precision medicine, precision diagnosis. When you're looking at what is actually going on in long COVID with the spike protein being retained in the monocytes, and talking about targeting therapies for with immunomodulators. So I learned from that, and brought information back to to help my patients, whether it's early COVID treatment, long COVID treatment, injuries due to vaccination, and so forth. But I did want to just bring up to comment that this was not a summit about vaccines. And that was very clear. The organizers of the event, and this was actually a Canadian organized event, so pretty exciting. And the fact that this was organized in a very short period of time. Literally everything was planned probably starting about 3 months prior. It usually takes a year to get an event like this planned. But this was done, with a series of Zoom meetings, and just engaging clinicians from around the world, and again, nobody got paid. Everybody came to Rome on their own dime. There was no funding. The event was sponsored itself by donations. They in order to to run it with the technology and rentals and all of this. But again, the focus was just on early outpatient treatment. It was not dealing at all with anything pertaining to the vaccines. And that was important. And Dr. Malone, he emphasized that on day 3 in his message to the media that we are not anti-vaxxers. This is not about the vaccines. We're not here to to discuss them, and we're here just to talk about our experiences in COVID care. So that was the excitement, and for myself, the event was 3 days. I made a 7-day stay in Rome. For myself, having another 3 days to experience the beautiful city and to explore and help refresh my mind, I think was very important because I haven't been anywhere outside. I live in Toronto, and I have not been anywhere in about 20 months. Prior to the pandemic, January 2020 was the last time I took any time off. Literally, I have been working every single week without a break, and which is, I have to tell you, it hasn't been easy. I have a full-time family practice. This keeps me going all day long, plus everything else that I'm involved with, with the Canadian COVID Care Alliance and all of the actual COVID treatments that I'm helping Canadians. So to have that, the few days to recharge and just to see what it's like in another country, in Europe. How are things done? What are the people like? How's the tourism? And so that was helpful. But now I'm back to reality.
Welcome back. But can you tell us about this Dr. Villa? Because I heard that kind of strange story that happened to that gentleman.
Yeah, this is a very interesting story, and I was not aware of all the events that the backstory at the time. So Dr. Villa is a physician from Paraguay, and he had no money to get there. His trip was sponsored, I believe, by his church, to fund, raising money to, fly him to Rome. And it took him 2 days to get there. So he didn't even make it to day 1. So he arrives, for day 2 at the Senate, and lo and behold, they wouldn't let him into the Senate because you had to have COVID testing, prior to arrival. And his COVID test, because it took so long to get to Rome, expired 12 hours prior. And not only that, they had a dress code. You required a jacket and tie to enter the Senate, and he wasn't aware of that. And so here's a physician. He's older. He has health challenges himself. His mobility is not good, and they wouldn't let him in. He didn't have the right dress code. His COVID test was expired. So others had to go help him get a jacket and tie. And I think he had to get another COVID test in order to enter the Senate. And, finally in the afternoon, he gets up, he comes to, he comes to the podium, he's limping up to the stage, and he's talking in Spanish. So I didn't understand, what he was talking about. But his message was interesting. He started by saying, they didn't want to let me in because I didn't have the right, dress code. But then he said, Jesus healed in sandals. So he then talked about his experience in Paraguay treating, although I don't know exactly what he said because it wasn't translated at the time. I'll have to listen on the playback. But this was I think a very moving, emotional story. The hardship that that this particular individual went through just to get there, and to bring his message, and you know, some of the setbacks just to get up on, you know, on the stage and say his words. But he managed to do it. He got there. They overcame the challenges, and he brought his message to the community. So that I think was a particularly you know, moving part of the speaker series that day.
Yeah, amazing. What about this declaration that was read by Dr. Malone on day 3?
So this was very interesting also. I was not aware that there was a declaration that was to be, that was read at the summit, that was drawn up by a group of people, including Dr. Malone, who had convened the week before in Puerto Rico. And this declaration that was read in its entirety, and I'm happy to read it and you know, talk about you know, parts of it, pertaining to physicians around the world, united and loyal to the Hippocratic Oath, recognizing the profession of medicine as we know it is at a crossroad. And I'll just read, you know, I think it's worth reading some of the points so that you know, so that people here can hear what, you know, what this is about, and why this declaration is read, and what physicians around the world, you know, want to do to, you know, to help change things. So it says, whereas it is our utmost responsibility and duty to uphold and restore the dignity, integrity, art, and science of medicine, whereas there is an unprecedented assault on our ability to care for our patients, whereas public policymakers have chosen to force a one-size-fits-all treatment strategy resulting in needless illness and death, rather than upholding fundamental concepts of the individualized, personalized approach to patient care, which is proven to be safe and more effective. Whereas physicians and other healthcare providers working on the front lines, utilizing their knowledge of epidemiology, pathophysiology, and pharmacology, are often first to identify new, potentially life-saving treatments. Whereas physicians are increasingly being discouraged from engaging in open professional discourse and the exchange of ideas and new and emerging diseases, not only endangering the essence of the medical profession, but more importantly, more tragically, the lives of our patients. Whereas thousands of physicians are being prevented from providing treatment to their patients as a result of barriers put up by pharmacies, hospitals, public health agencies, rendering the vast majority of healthcare providers helpless to protect their patients in the face of disease. Physicians are now advising patients to simply go home, allowing the virus to replicate, and return when their disease worsens, resulting in hundreds of thousands of unnecessary patient deaths due to a failure to treat. Whereas this is not medicine, this is not care. These policies may actually constitute crimes against humanity. Now, therefore, it is resolved that the physician-patient relationship must be restored. The very heart of medicine is this relationship, which allows physicians to best understand their patients and their illnesses, to formulate treatments that give the best chance for success while the patient is an active participant in their care. Resolved that the political intrusion into the practice of medicine and the physician-patient relationship must end. Physicians and all healthcare providers must be free to practice the art and science of medicine without fear of retribution, censorship, slander, or disciplinary action, including possible loss of licensure and hospital privileges, loss of insurance contracts, and interference with government entities and organizations, which further prevent us from caring for patients in need. More than ever, the right and ability to exchange objective scientific findings, which further our understanding of disease, must be protected. Resolve that physicians must defend their right to prescribe treatment, observing the tenet, first, do no harm. Physicians shall not be restricted from prescribing safe and effective treatments. These restrictions continue to cause unnecessary sickness and death. The rights of patients, after being fully informed about the risks and benefits of each option, must be restored to receive these treatments. Resolve that we invite physicians of the world and all healthcare providers to join us in this noble cause as we endeavor to restore trust, integrity, and professionalism to the practice of medicine. Resolve that we invite the scientists of the world who are skilled in biomedical research and uphold the highest ethical and moral standards to insist on their ability to conduct and publish objective, empirical research without fear of reprisal upon their careers, reputations, and livelihoods. Resolve that we invite patients who believe the importance of the physician-patient relationship and the ability to be active participants in their care to demand access to science-based medical care. In witness whereof, the undersigned has signed this declaration as of the date first written. So, Dr. Malone read that in its entirety, as I have just now, and I signed it immediately. I logged into the declaration website and immediately added my support for this. And in fact, if you go to the website where the declaration is, which is doctorsandscientistsdeclaration.org, you can read it in its entirety and see who are the co-signers, and you will see me right there at the top with my photo. I was quite surprised that I'm listed first. So if someone's going to attack all the doctors, they're going to come after me first because I'm top of the list. So I'm not sure if that's good or bad, but this certainly resonated with my approach to managing COVID and helping my patients. So I was happy to be one of the first signatories on this declaration. And I believe there's over 1,000 physicians who have signed it. I don't know what the actual number is, but I think that's what I last heard, or maybe it's 1,500. I don't know the number. It will be. It's being circulated, and so that is our a message to the world, to the media, to the scientists, to the health agencies, to the governments, to all those who who are challenging what we are doing, and we will continue to push out this message because the message is important, and there what's really interesting is there are many countries who are doing a much better job than we are in the developed world, in North America and Europe, and many countries where there is active suppression. But it seems many of the developing nations have endorsed early outpatient care, using these repurposed medications, including in Central America, I believe Honduras and Mexico, and of course India, Uttar Pradesh, and the different provinces, and Japan now endorsing ivermectin, all taking the opposite approach to what's happening here in Canada and the United States, where they are now trying to actually ban the use, dispensing of ivermectin. It's really it's disheartening what is going on. So, but we will we're here just to look bring the truth, the science. The science is there. It seems so many people just don't want to look at it, accept it for whatever reason. But we will continue our messaging for the world.
Before we move to the Canadian situation and this new declaration by the Canadian COVID Care Alliance, there is a say that everything that happens, everything that happens in Vegas stays in Vegas. So what is staying in Rome in your particular situation?
Nothing. Nothing is staying in Rome because this was a open. Everything was recorded. This was not a private event. This was an event for the world. This was live streamed to 140 countries and so there were no, there were no private, you know, matters. There's no, there were no secrets. It was all good, all open.
Wasn't vaccination the talk outside the formal sessions?
Actually, it wasn't. It wasn't. We this was not this was not a formal, even informal, discussion. Although Dr. Malone did have a discussion with one of the Italian, I think, members of Parliament regarding a vaccination in a one-on-one. He also had a meeting with a cardinal at the Vatican during day 2. So I don't know the details of what was discussed there, but for the the summit itself, it was not about vaccines. That will be for another meeting, an upcoming meeting, I imagine, because there, as we know, it's another important aspect of COVID care, but not the focus of this particular meeting.
Talking about Italy and the Vatican, one is that the fact that you had this opportunity to present in the Senate is because there was a resolution in the Italian Senate in favor of early outpatient treatment. It's one of the few countries in the world that did that, but that resolution was not endorsed by the full parliament and has not been enacted. But it's still very particular, very special that the Italian Senate endorsed early outpatient treatment. And within Rome, we have the Vatican that is firmly promoting vaccination as an act of love. And I wish they would be aware of the true risks associated with this vaccination as it comes out of several studies now, but this is not the topic of this present discussion. Now, regarding the Canadian COVID Care Alliance, which was created about 6 months ago, and which started step by step now with about 400 members. Yesterday there is this declaration that came out, and it goes way beyond early outpatient treatment. Can you tell us about this declaration?
Sure.
Which I've posted, by the way. I wrote a brief article about it this morning, so you can find it on covexit.com. You can find a summary, and I've also made the full declaration available. But this is kind of a significant development. So please.
Yes. So the CCCA released this declaration yesterday. It's addressed to the Canadian government, Public Health Agency of Canada, Health Canada, and the media, and really the world. It's a 32-page document, and there is a lot of meat in it. It really, I just read it for the first time yesterday, and the nice thing is it's all evidence-based. Everything is referenced with all the science to back up the statements. But there's a one-page executive summary, and that's followed by the details going into each point. So focusing on just some of the points in the executive summary, talks about removing the declaration of emergency. Next, talking about the developing effective national outpatient treatment guidelines based on the most up-to-date evidence, instructing the Public Health Agency of Canada to inform and educate physicians and the general public about the importance of prophylaxis and early treatment of COVID-19. The government should ensure necessary supply of repurposed medications and prophylaxis agents. There's a request to pause the current COVID-19 vaccine program pending full evaluation of the impacts and benefits, halt the vaccination passport program, and do not permit any company, agency, or organization to unlawfully mandate COVID-19 vaccines. Do not permit any infringement on medical privacy by governments and businesses, and end all coercive measures limiting freedom of the individual medical choice. Do not permit infringement of the ability to move freely both within and between provinces, as well as internationally. And there's a couple of other points. It's certainly worth reviewing the document and seeing the position endorsed by the Canadian COVID Care Alliance, and all the the supporting documentation to to support these requests that are that do counter much of what is going on in Canada right now. So we want to engage stakeholders within the Canadian governments, both provincially and federally, based on the science. We want to have these open discussions. Things work better when you have dialogue, and as opposed to emails and this and that, and he says, she said. You have to engage the relevant stakeholders. At the same time, we'd like to engage our provincial government for much of the same. We're trying to work on that, and so that's this is brand new, and I would encourage others to to have a look at what the Alliance is doing. It really is. I'll tell you, I'm amazed at what has developed with the Canadian COVID Care Alliance. It began. I'm one of the co-founders. There are three people who got together. Myself, Dr. Jennifer Hibbard, and Mr. David Ross. We were linked together. Jennifer had first contacted me after reading the newspaper article about one of my COVID treatments. This was published in one of the Montreal newspapers online, and so she had called me at the office. I'd never talked to her before, and then we got linked together through Dr. McCullough, with David Ross, and so we got together and we sort of connected with other like-minded physicians and scientists, and we started meeting, and ultimately we formed this organization that became called the Canadian COVID Care Alliance, that has doctors, researchers, scientists, and other concerned people across the country. It's now opened up to others who are interested in membership. It is a not-for-profit organization, funded by donations and a small membership fee, and has really quite escalated in its membership and interest. Everybody who is in this organization is there on a volunteer basis, working, providing their support, their interest, their passion on one of the many different committees that we have, whether it's the Science and Medical Advisory Committee, Ethics and Legal, the External Communications. There are I can't even keep track of all the different committees and the work that is really being done by passionate group of people, all volunteering their time, many in addition to their full-time jobs, much like myself. So and we have multiple meetings. Each committee has a chairperson, We have a steering committee, and one of, mention one of the other projects that we're working on diligently right now. I'm on the committee. We are looking to introduce a telehealth, telemedicine a service for outpatient COVID care for both prophylaxis and treatment. Right now, it's very difficult, since there is no organized structure to help Canadians who are looking for help. Everything is currently done, manually on a one-by-one basis. We're sort of triaging when people contact us saying, they have COVID. Is there a doctor that can help me? And all of our physicians, and I have to say it's not a huge group across the country of doctors available, or nurse practitioners to provide this care. But once we have a platform up and running, we'll help attract other clinicians to provide this coordinated approach to helping Canadians. So we're looking forward to that. We're hoping by the middle of October it will be established. The difficulty that we've had is finding the right vendor, the software vendor that has the platform to do what we need to do, because there's nothing in Canada, there's no one doing anything like what we are doing in telehealth, where it's national, so providing care to all provinces, dealing with different time zones and scheduling appointments, and there are many moving pieces to this, and we've looked, our committee of 9 people have looked at, well, actually it's 2 people who have done most of the work at some I think about 25 different platforms, and almost all of them have not had the abilities to provide what we are looking for, and so that's been a real challenge. But we found a service from a small Canadian company this week that seems to have most of the features that we require, and they have developers who are eager to support our venture, which is quite good. So hopefully we will get this going, and we have a huge backlog of people that have contacted the CCCA looking for basically having prevention treatment available in the event that they get COVID. We probably over 1,000 people that were just it's frightening. So it will be, the team will be very busy once this is up and running. The difficulty for me, I'm a full-time physician in my office, and so I'm stretched pretty thin in terms of my own availability to provide the additional support, since there isn't enough time in the day. So I would have to end my family practice of 29-30 years, and if I was going to focus on that. But who knows? We'll see where that goes.
Now, a question here. You have these people like-minded like you, basically endorsing early outpatient treatment, and that Canadian declaration. You have a large majority of doctors in Canada who are on the fence, or outwardly or directly opposing about every single line of that executive summary.
Yes.
So this is a completely divided medical community. What is your message? How do you bring people to at least let you operate, you see, as a telemedicine services, as a practitioner of early outpatient treatment? How do you bring people given this huge division in the medical community?
So, you know, we have the backing of the science. I mean, there is data to support everything that we are doing. We are now over a year and a half into this pandemic. And as you know, there are clinicians who have treated thousands and thousands of patients. When you just look at, like, for example, Dr. Fareed and Tyson, who've treated thousands of patients very successfully with early treatment, with, you know, their hospitalization rate is almost zero. It is so low with early treatment. Dr. Zelenko, one of the early pioneers in New York, with his protocol of hydroxychloroquine, azithromycin, and zinc. I mean, these are the pioneers. Again, his team treating thousands of patients. You know, those who treat know the results. Those who have experience, we see the help we're providing to our patients. You know, I see in the patients that I've treated, since November, that hospitalization rates are very low. The earlier you treat, the better you're going to do. This is a fact. Now, granted, some patients, certainly the younger you are, you might have just a very mild illness and recover, without any treatment at all. But, you start adding risk factors, and of course, with the more virulent spreading Delta strain, and perhaps, future variants that may come along that may be more transmissible, with higher viral replication rates. We know that treating them early will give an earlier recovery, and that what we do know is the percentage of people who end up with long COVID symptoms. Long COVID simply represents untreated COVID. This is a fact, and that's why offering patients safe, key is safe. And we have these, these repurposed medications which have been out for decades, so we know they're safe. I don't know why there is this narrative that says, these medications are unsafe, and people are ending up in hospital and blocking care to those who need it. I mean, it's all talking about fake news that the FDA and Health Canada seem to like to endorse. But we have these, safe medications, and when used appropriately at the right time, in the right place, and the right patients, your patients will recover sooner and not develop long COVID. That is a disease state in itself, related to the pathophysiology, related to the spike protein. Dr. Patterson, he's the guy to talk to about that. He knows all the ins and outs, and diagnosing with his diagnostic tests, as well as the management of long COVID. But why would you want to treat long COVID when you can treat COVID early and have people feeling better sooner than having them feeling unwell for months after a COVID illness, and a longer recovery if you don't treat? Doesn't make sense. Everything is about early treatment for many reasons.
Anything you would like to add before we close the interview?
Well, I think my messaging has been fairly consistent and I guess repetitive. That one should. I'm always telling people, ignore the noise, because there's a lot of noise. Look at the truth and the actual evidence, and endorse early treatment, because you have to ask yourself, what is the downside? Why wouldn't you treat? Why not? Why not? I ask people who are naysayers, well, what if you contracted COVID, well, what would you want for yourself? And often they look puzzled. I actually had a discussion this morning with a professional who has a different perspective than I do, and his feeling about ivermectin and hydroxychloroquine from his reading was that these are ineffective treatments. So I asked him, well, if you had COVID, what would you want for yourself? And he says, I wouldn't want ivermectin or hydroxychloroquine. I said, okay. What would you want? Well, he said, dexamethasone. So,
6 milligrams.
That's fine for for the inflammatory, for day 8. I do use the corticosteroids when we miss the boat on the early treatment. So I don't use dexamethasone. I do use a lot of prednisone for the inflammatory phase. I have been treating lately a few pretty sick patients who have come to me on day 12 approximately, who don't want to be, who should have been who could have been in hospital, and I'll tell you, the biggest fear going to the hospital is ending up on a ventilator, and and the standard of care in the hospital is dexamethasone and remdesivir and oxygen, and that's it. Supportive care. They will not use any of if you ask for ivermectin in the hospital, they'll deny you. I don't know any hospitals that are using it. It's really quite a tragedy. What's happening in the hospital setting. They won't use any of the protocols, such as the Math Plus protocol from FLCCC. It's just very very foreign, and won't be used. It's difficult if you do end up in hospital. So I've managed to treat some pretty sick patients at home, ordering home oxygen for them, and using multiple medications in order to get them through. And touch wood, my track record has been pretty good. So I think I'm doing something right. that I say that most physicians won't they won't touch. I mean, most of my primary care colleagues don't have the knowledge or experience, and I guess perhaps fear of treating. I think a lot of doctors have this incredible fear, because the medical press has been has been promoting that same narrative, that ivermectin, for example, is for horses, and this has been a human drug for 40 years and used in billions of people, and so none of these things make sense. But I can tell you, like, even the press that my colleagues that if you all physicians receive the medical post, and just this week, on I think it was Monday or Tuesday, they had a hit piece on ivermectin, written by not a clinician, by a PhD, and putting out that health, the same Health Canada FDA type messaging that this is horse medicine, and basically it's snake oil and shouldn't be used. And unfortunately, I would say most physicians, this is what they read, and so it's difficult, I guess, educating and helping to get many clinicians to use these medications and treat their patients early. I mean, I would say to them, well, I would say, if you have a better method for outpatient treatment, please share it with me. I'm eager to learn other protocols. If there are other medications that you have that work better for you, share it with me, because I'll use it. If something works, I'll use it. But usually they don't have anything. Because they believe that there are no treatments. The Ontario Science Advisory Table says, there are no treatments. They say ivermectin should not be used outside of a clinical trial. Hydroxychloroquine is dangerous, should not be used. Vitamin D, they think that you may harm your patients with vitamin D. But this is the messaging that others are receiving, which is contrary to the messaging that I and our early treaters are using and having successes, as are thousands of doctors around the world. It's not us. Are we all wrong?